Hi, can you hear me?
Okay, I'm going to take the silence as a yes. Well, let's begin our third panel discussion, which is based on moving towards a healthier lifestyle. And to moderate this session, may I please invite on stage with a thunderous round of applause, Dr. Asavri Sawant, Public Health Specialist, IHW Council. Let's welcome her with a huge round of applause, please. Esteemed panelist on stage, Mr. Vishal Gondhal, founder and CEO, GOQII. And Innovation, EMIDS. And joining us virtually is Mr. Kshitiz Kumar, Vice President, Health Systems, Philips. A warm welcome. Ma'am, over to you.
Good afternoon, one and all. I hope I am properly audible. Yes. So let us start with this session. I hope the lunch was nice and we can move forward with more discussions with our health. This is no exception. This process was further pushed to gear by COVID-19. The pandemic not only ripped us off of our comfort zones, but also forced us to think beyond the conventional healthcare by taking full advantage of the technological advances present all around us. From building cities that encourage healthy lifestyle with enough open place for outdoor activities, to adequate green cover for cleaner environment, to creating policies discourse has added newer dimensions to the gambit of health. As evident in the Indian agenda of G20, the government is looking for ways to involve private players to fund projects that are based on transitioning of energy from fossil fuels to more renewable options. Conscious living through sustainable cities to consumer appliances. And will focus on bringing voices from the consumer goods industry discussing about innovative and path-breaking products that enable healthier lifestyle and consumer well-being while also initiating the shift towards greener and healthier energy sources. Founder and CEO of Koki, welcome. Also welcome Dr. Karthik Ramesh, who is VP of International Markets, Head of Transformation and Innovation at EMIDS. Philips. I welcome Mr. Kumar as well.
Thank you.
So Mr. Kumar, I hope you are able to hear us well. My first question would be to you. What are some of the factors that have accelerated this shift towards cleaner environment as per your, thinking? And when it comes to sustainable choices, how can we implement them in a world that is too dependent on non-renewable energy still? Over to you.
Sure. Let me know if I'm audible on that side.
Yes, you are audible. Please go on.
Excellent. Excellent. So I think there are quite a few reasons why we see a sudden shift, and actually not such a sudden one as well, is shift towards the renewable energy sources that's happening, right? We have lived in an industrial era for the last 2.5 centuries, where coal was the predominant fossil fuel. We have been using it. Petroleum came up 100 years back, and that's been the source of energy that's been powering Earth as a planet for a long period of time. Even today, we depend a lot on on the resources which are completely non-renewable, and all of us understand that it is not the best source of energy today. Fortunately, what is happening is that I think as a world, we are opening up to a situation where we see that the renewable energy is making a transitional shift. One is like sources of renewable energies, be it wind, be it solar, are all kind of coming up with latest and the greatest technologies to make it a possibility. It is moving out from a research to really applied in our day-to-day life, right? So that's a big shift. That is why the renewable energies are picking up, because it's no more a R&D kind of a thing. It is now more applicable in the real life. The second shift is about renewable energies are becoming cheaper and cheaper as more and more fossil fuels become difficult to get it out. Be it coal, be it petrol, all those fossil fuels are becoming more and more expensive to get it out of it. And we all kind of understand that's a limited source. So relatively renewable energy, which looked like the economics were not in favor maybe like 30, 40 years back, is now tilting it towards more and more towards renewable energy. And of course, I think the world is also waking up to the reality that the way that we have lived in the past is not the way that is the way forward. And I think that overall consciousness around the climate change and how much is a contribution from the fossil fuels is all coming up to hit us hard. And I think that is the one that is changing significantly. So these are the three things that I would look at it and say like tectonic shifts are happening on the renewable side, and it's going to get bigger and better in the times to come.
And more awareness on the much needed shift from mindless consumption to clean energy be created, as per your opinions? And what role can the consumer industry play in this shift, and how? This is for you, Mr. Kumar.
Sure. Okay. I was not sure. I didn't get the first part. So I think let me start by saying this. Okay. And that gives me a lot of pride that as an organization, in 2020, we are actually reached our carbon neutral goals. So clearly, we are responding to what the consumers are asking us to do. And consumers are asking us, and the stakeholders in the society are asking us to move to a more sustainable energy form that we are doing out there. And I think that is out there to stay. As I see it, it will probably start, and it has already started in the developed world, of saying that how the organization, how the companies are becoming more sustainable in their energy sources. How are they? What is the carbon footprint that they are doing? And this is all becoming a part of the balance sheet as well, the triple balance scorecards, etc., that we keep on talking about in our annual reports. And it is out there from the investors, the stakeholders, all those pressures are building it up as well. So I see a positive momentum coming out, and I think it is out there to stay right now.
Thank you so much, Mr. Kumar. So on the same tangent, my next question would be to Dr. Karthik. Sir, how, in your opinion, can businesses capitalize on the inputs that have been shared by Mr. Kumar that will lead to more and furthermore?
I think it's a very heavily loaded question, but I'll give an attempt to that. I'm a little bit of a storyteller, so let me take you back to many years back. My great-grandfather was the founder of BITS Pilani, which is one of the world's India's top private institutes. At that time, I'm talking about after World War II, when the world was at risk, effects of the war, he was entrusted with this goal of setting up India's first private, institute of technology in the middle of a desert, right? So conditions of what the industry today talks about, as VUCA, which is very cliched, has now post-pandemic translated to Bani. And let me kind of elucidate Barney for you. Barney is brittle, anxious, non-linear, and incomprehensible. So the environment is not just the nature cars, but electric cars themselves use batteries, which are not produced by renewable means, right? So it's not that the world is going to continuously undergo this change, right? And I gave you this anecdote of what happened to my grandfather because mindset and with the objectives to create a co-innovation system. You know, if something like an institute of eminence can stand in the middle of a desert, companies should ask themselves this question. And let me give you another example. I spent 15 years of my career working with top multinational banks. I left the bank 5 years back. We were very, very conscious about carbon emissions and only investing in companies which did the right thing when it came to carbon credits, making sure our operations were deriving sustenance from renewable sources of energy and leading to zero carbon emissions and declining. And many times I've seen some of the frameworks of large banks like the ones I've worked in declined credit line of credit facilities to businesses which were not carbon neutral or which were contributing a lot to carbon emissions. So I started off by talking about mindset, about having the vision, about creating an innovation ecosystem, but most important is this commitment. And today, last 5 years, how Barney our life is, right? So it's no longer just about the environment around us, but it's also about individual wellness. Let me also tell you another quick anecdote here. 43 years back, my grandfather graduated from Harvard in environmental engineering, right? And he set up for United Nations and for the Indian Institute of Technology, Madras, what is called the Center for Environmental Research. It's very connected to the topic. So back then, his postdoc or his doctorate did not make sense when it spoke about water conservation in 1968-69. It's no longer about conservation, it's about the best effective use. So somewhere I think businesses should, as Steve Jobs said, look back. You connect the dots only by looking back, not looking what businesses are undergoing today, and how do you then define the mandate ahead is what is going to be critical for businesses. Thank you.
Thank you so much, Dr. Karthik. By Mr. Vishal Goki is also very much into the health and holistic health and making health part of your everyday routine. So I would like to know from you, how can longevity and improving longevity of human health be a central part of our healthcare scenario? How can everybody work towards not just providing basic healthcare services, but making a better quality of life for every individual present on the planet?
Today's healthcare is sick care. It is not designed to disorder. You go to a doctor, you go to a hospital, you go to a clinic, you are given a medicine, but you come back and continue eating junk food, continue smoking, continue drinking alcohol, continue having a sedentary life. And that is what is leading to all the comorbidities. And we just saw during COVID, people who had comorbidities suffered the most, and especially people who were aging. And today, the challenge is that you can age, but you will be on dialysis, you will have double bypass surgeries. So even at the level of aging, while medicine can make you live longer, but the quality of life is becoming very, very challenging. And we all have, parents, grandparents, and people who in our family, we have all seen this firsthand. On the other side, there are billion-dollar companies who profit from our laziness. Let us look at companies like Netflix, Facebook, Instagram. They are incentivized to keep us lazy, to make sure we don't sleep. Companies like Zomato and Swiggy, they are constantly trying to sell you burgers, pizzas, and biryanis at discounts. Again, while we all want you to eat healthy. And then there are companies now who are saying, don't even step out. We will deliver everything in 5 minutes to you. Normally, we all stepped out to at least buy bread or, grocery. By an environment which is not wanting you to be healthy. So I wanted to change that. My background comes from the world of computer games, and of course computer games are making you lazy, but my idea was that how could we use the same techniques of gaming but to shift your lifestyle to make you live healthy. And in my words, I call it, how do we make you level up? How do we make you level up in your health? And that was the idea behind Goki. So longevity, the way I think about longevity is that think of a video game. In a video game, I can give you 5 lives. So how do we live longer and healthier lives? And to do that, the framework which centers around sleep, nutrition, fitness, meditation, mindfulness, and finally happiness. So the framework has been well established in a way which changes the game. So that's really what Goki is trying to do. We are creating an ecosystem which has health coaches, doctors, wearable devices, data at the center. You get points, you get rewards, you get even karma points which you can donate to charity. So the whole idea is that we are trying to give you instant gratification for something which takes a long time. Unfortunately, good health takes a long time, but eating a burger and pizza will give you the immediate happiness. So how do you convert that into instant gratification is what we are trying to crack. And lastly, my biggest ally are people who spend on healthcare. So insurance, family spending on healthcare. And what we have now done is we have integrated our model into dynamic insurance pricing. So what I'm telling you is you live longer, but because you are healthier, your insurance premiums will be different than somebody who is at the same age but who is living a sedentary lifestyle. So connecting all of this finally to paying the healthcare expenditure is what will change the game.
It was amazing to understand. So, yes, bringing the gaming model into healthcare and into your everyday life would definitely make it more attractive for every individual to follow a healthy lifestyle for longer, years of his life, thereby enhancing the overall health. So, Dr. Karthik, what would be your input? Sustainable framework which would enhance the overall health of not just the environment but also human.
No, I would really start off by complimenting what Goki has done, and what Vishal just spoke about is so inspiring. And digital engineering service EMIDs work with the top Fortune 100 companies in the US. But that apart, my day job with my team is to sit in IIT Madras with health tech companies. I've seen many successful business models, especially starting pre-COVID. I've seen companies which have, right? So based on your food habits, controlling your sugar. No longer it's about insulin levels. It's not about the medication, as Vishal is saying, it's not about the post, but it's about the prevention which you can do to ensure you're in a state of wellness. And increasingly, EMIDS also being a company which is backed by a large private equity firm called as New Mountain Capital in New York, bringing this awareness. It is about educating yourself about the do's and don'ts, especially when it comes to wellness. Now, the US, for example, when we work with system providers or talk about hospitals, The COVID saw the onset of what we call as virtual healthcare. Telemedicine has been around for quite some time. In fact, founder of Practo is actually on the board of EMIDS. But if you look at it from what providers were talking about, hospitals, care providers, about how people could still get treated or they could consult about wellness from the comfort of their homes, right? So companies were investing more in that in the US, as we saw, which means it translated to lesser footfalls physically into the hospitals or the clinics themselves, but people still got the same quality of care. And more of our clients today globally, and my own experience outside EMIDS working with other large health plan organizations, typically Blue Cross Blue Shield run plans in the US. What I've seen in past lives before EMIDS is companies are also investing in terms of how do you know, there's a talk here about reducing the insurance premium, right? By following some good habits, by leading a healthy lifestyle. What we saw. Okay. So what I did see is that companies in the US, again especially, were looking at how to educate people about the preventive side. Biggest profit makers in the industry today are the pharma, the life science companies. I mean, I should not be saying that because they're. But in the IIT, again, one of the sustainable experiments which we did in IIT Madras recently was we spoke to 100 real life customers in the US and other parts of the world to understand where the challenges for health. We even created a platform which should kind of syndicate data from wearables, from all kinds of devices. How does this translate to, you know, again, going back to what Vishal very beautifully said, preventive healthcare, does it give some insights into patterns? So again, it goes back to connecting the dots, deriving the intelligence out of, you know, the inference which we can make. Thank you.
Thank you so much, Dr. Karthik. So Goki has been a pioneer in bringing evolving technologies in preventative healthcare and also initiated new and innovative projects. Can you please give us some insights on the concept of healthy lifestyle and virtual world together and health metaverse?
So I think the health metaverse and Web3 is going to be a game changer in the world of healthcare. And the reason is because fundamentally healthcare lacks, which is incentivization of behavior changes. And I want to actually show you a small video which kind of outlines the vision on how we are connecting gaming in the same way. And this project, by the way, we are about to do our first trials in UAE. The UAE government has been extremely forthcoming on trialing new technologies. We are going to do some of that in other parts of the world. And in fact, at some point of time, we'll be also launched in India. So if we can play the video, I don't know if your team already has the video, we will get that off the ground. I think while the team is setting up, the only one other point I want to add over here is that if you look at healthcare, one very important aspect of healthcare is data. So far, the data was with hospitals and doctors, and people like us go outside a hospital and eat bhel puri on our medical reports most of the time. So healthcare data was not valued, misused, and it's lying somewhere around. COVID has changed that. Suddenly, all of us have digital vaccine certificates. We all have blood reports and all kinds of things which we never knew. We suddenly what should be a level of oxygen and so on. So what happened is in the last 2 to 3 years, healthcare data has reached their own health data, which is what is leading to personalization. You are now saying that please look at my report and tell me what to do. And that is when the game changes of health, when consumers are empowered with data. And this data flowing into a AI ML system, combining with a behavior changing algorithm can completely be the game changer. So what you are going to see in the metaverse example is we are literally creating a character of yours in the metaverse whom we call your avatar. As you become healthier. So it's a video game where the character inside the video game, which is your avatar, is controlled by you outside. So if we can play the video, we can just start. Okay, there's audio also on this. There is audio also in this, I think.
In partnership, there is no greater wealth than good health. Goki has always strongly believed in this, and driven by this very idea. In partnership, anything to the brands, making every undertaking. Good health has always strongly believed in this. It's driven by this very idea. We are proud to launch the Goki's Health Metaverse in partnership with any.
While we can see this video offline, I think the fundamental idea is that there is your digital avatar connected to your health data in the real world. As you become healthy, you're rewarded with a token, which is a cryptographic token. So this token, then we are creating a network of doctors, hospitals, insurance companies, health food companies, protein, supplements, all kinds of health. So just like how airlines have a mile system where you earn an airline mile by flying the airline, and then you go to the hotel and you pay for a hotel room or a car or a restaurant, airlines have created their own networks of their providers. Similarly, we are envisaging the creation of a health network completely powered by the token, which is proof of health. And every government wants their people to be healthy. Every insurance company wants their people to be healthy. So they will be willing to fund this entire ecosystem because the proof of health is what is coming in. And in the future, for you to be a superpower, you no longer will need bombs and armies. Have a country which is the diabetes and whatever capital of the world, there is no way you can be a superpower even if you have a $10 trillion economy, because another virus will come one day and wipe your complete GDP out.
Thank you so much. So Emits also is working on similar and maximizing the technology to deliver better healthcare. So, sir, can you talk about how we can together work and, bring about the change that of healthcare, but also now the preventative and predictive aspects of and the future that is there for the healthcare sector?
Sure. I'm going to talk a little bit of not probably, which is in the history of India, the biggest healthcare hackathon last year, end of last year, right after the Honorable Prime Minister launched Smart India Hackathon, huge success. IITs, 23 IITs, private, around 450 plus universities, created an environment which was kind of a melting pot of ideas. All through this conversation, this panel, we have been talking about healthcare ecosystem. So we realized as a company, it's been in the business for a quarter of a century, that The ecosystem is the best feedback for you, is the best melting pot of ideas for you. And we generated over 10,000 different ideas of drones to rovers. And the trigger point for this personally for me also was during the onset of COVID, when I actually had moved back to banking and I came back to EMIDS. I had to transition my knowledge from a bank to, to do it again is to mentor global hackathons, right? So I mentored around 7 governments of this world, including the United Nations. United Nations, IBM, SAP came together to create again this at scale, which meant people from all backgrounds, not just healthcare, academia. And sometimes you need people with a different hat, not just the lens of a healthcare or wellness. You need somebody who is outside this picture, right? And I remember one of these hackathons, some of the interesting solutions which came, which I'm seeing light of today, even before metaverse came. We spoke about solutions like today we talk about Aadhaar card, and EMIDS is incidentally involved also with Dr. Mansukh Mandia, who's the Union Minister of Family Welfare and Health. Last year we developed a preventive healthcare dashboard for the government of India at Delhi, which showed the locations of the nearest primary healthcare centers and what are the kind of spread when you look at non-communicable disease, how access before this concept of universal ID came, right? I saw people who were totally agnostic of healthcare background 2 years back at the peak of COVID talk about a unique ID, right? Which was something like the Aadhaar, which could store not just your wellness information, but say you're transiting through an airport. Earlier, you had to do your PCR test. Take out your mobile phone at every airport counter, they'll say, show me your vaccination, show me first dose, second dose, booster dose. But what if all of this was on a single app? We spoke about UAE. Governments of UAE today have established health information exchanges, which is not new when you look at it. The global healthcare very similar to what the ABA wants to achieve in India. You walk into any hospital in the UAE, any of the Emirates, your patient record is easily accessible. In fact, the world's first hospitals have been launched from the UAE itself. So more and more we are seeing, the point I'm no longer just about environment is too much of a motherhood variable, right? It's just talking about something at scale. And how do you again string together all of this to create some meaningful outcome? And this is no longer about business. And that's why I gave you examples of it is being monetized today, but at the same time, it is something which we inherently are entitled to. And I think if companies can come together to do this, be it life science, with the sincere, genuine interest of improving the overall wellness of humanity at scale, we will see innovation also, scale tremendously. Thank you.
So I just want to add one point which Karthik just made, right? And since all the people in the audience are in the healthcare world, you are influencers in your own problem, which most people think about health is data or access or information. They say, oh, I'll give you one number, I will tell you where the hospital is, I will give you this advice, I'll give you this medicine or supplement. Everybody knows they should not smoke, drink, eat unhealthy food, but they still do it. Cigarette ke pack ke upar there is a photo also which says this is going to get cancer, but people are still smoking. So is it an information issue? Maybe for a very small percentage who are still living under a rock and they don't know they should not be, doing all these things. It is a motivation issue. It is an issue of aligning interests in the ecosystem. We did a survey of 10,000 people in 2018, asking them, who do you trust in health? 98% people said they don't trust doctors. They want second opinion, third opinion. They don't trust hospital. They don't trust insurance company. They don't trust pharma company. We asked them, who do you trust? Number one name, Baba Ramdev. Number one. No wonder we are going to have, Patanjali going public, because consumers trust Baba Ramdev. Number two name, by the way, was Akshay Kumar. We were lucky enough to then get him as our brand ambassador, because that's what we went and told Akshay. Absolutely missing in the healthcare system. So even after investing billions, making apps and creating,
Mr. Vishal, that was a very solid point that you brought forward. And what can we do to build trust back into the healthcare system can take another entire day for us, and we can have lots of ideas and
without
deliberations.
that, nothing is going to move. That's the problem.
Yes. So, but as we are very short on time and we have stretched enough, we will end this session right here. And maybe in future sessions, we can have this discussion more in detail with you and all the other panelists present for joining us. Thank you, Mr. Vishal Gondal, Dr. Kartik Ramesh, and Mr. Shitish Kumar for joining us for this session. We would like to wrap this up now. Thank you so much.
Thank you, Savari Sawan, to hand over a token of appreciation to our panelists. Sorry. Mr. Vishal Gondal, let's have a huge round of applause, please. And Dr. Kartik, can we please have a group picture? Thank Well, ladies and gentlemen, now to give a technical presentation, President International Business Development, Salukro. Let's welcome him with a huge round of applause, please.
Hello. This is the next. This platform exists everywhere. You don't have to worry about any of the payment systems, any of the integrations there, any of the complexities to do with it, any of the support issues to do with it. You don't have to worry about any of this as part of a healthcare facility. As a healthcare facility, my core job is to provide healthcare day in and day out. And at the same time, you have to also keep your patient experience also at a higher level. And with these things not in place, the patient experience also suffers. And this is where we're bringing in, and this is a quick flow that I wanted to show you how this thing really works, how this platform integrates, how this platform talks, and how this platform communicates. Now, what do you really gain as a your technology platform? Two, multiple payment options, multiple payment systems available for you for utilizing. Three, you have integration which can be easily done in your patient accounting system, your patients who are in the remote facility. Now somebody calls in and says, look, I want to book an appointment, and then doesn't show up. What would you want to do? You would want to book a small amount with that appointment. The rest the person can come in and make a payment for it. So when you send a payment link to the person, you get the information in real time about that the payment has been completed. You have automated reconciliation as part of it, multiple reports coming in. Now imagine you're providing options for to be collected through UPI, through a phone pay app, through a Google Pay app, through a Paytm app. You have credit card payment. Now enabled as part of your system. Now, if you do not have a platform like Salucro, first of all, you won't be able to offer it in one go. And now you're able to offer it in one go. Then you have to worry about the reconciliations of all these 12 different payment systems, the integrations of quick benefits when you're utilizing a technology partner, when you're utilizing a solution for the healthcare, which is focused exclusively on healthcare and works only in healthcare setup. And when we do all of this, what we are doing is we're keeping the technology costs low, we're keeping your operations costs low, we're keeping your support costs low. So that somebody who doesn't have enough money immediately available can still afford that healthcare and convert them into smaller financing options. So through that, you can, through the platform like ours, you can quickly enable these solutions, you can quickly enable these payment methods without having to worry about whether the money will reach my account or not. All of that, we're doing all of that. It's now, today, most of the hospitals have integrated it, but they don't have a properly, a truly omni-channel integrated payment platform. And this is what we're trying to bring in. As part of your healthcare system, as part of your healthcare delivery processes. A quick update about our company, who we are, what we do. So we're Salucro, into payment solutions exclusively in healthcare. We don't work in any other domain or any other sub-segment. We're focused exclusively on healthcare. We started back in 2004 in US. Today we are live in Canada, how beneficial this platform has been for them, not just during the COVID period, because their revenues, looking their than anybody has in the group today. We have a booth as well. You would want to reach out to my team, to me. I'm available here till the end of the session, and we can quickly get chatting and understand what you would look forward to in terms of your setup and payment solutions for your healthcare setup. And if there are people who are looking for the payment systems for their partners and for their channels, we're more than happy to help you with that. As a no, thank you for listening to me and have a wonderful day today at IHW Summit. Thanks a lot.
Well, thank you so much for a wonderful presentation. Well, ladies and gentlemen, moving on to our next panel discussion of the day, which is transforming the pharmacy of the world. Please invite on stage Mr. Prabhat Sinha, Director of Policy and Government Affairs, Baringer, Ingelheim, India. Let's welcome him with a huge round of applause, please. May I now invite our esteemed panelists on stage, please. Let's welcome them with a huge round of applause. Mr. Business Head, India and Mr. Pradeep Patni, CEO, Ecumentis Healthcare, and Mr. Nikhil K.
So, good evening, everyone. This is the most difficult session for you to listen. For us, it's, I think, normal. After such a good lunch, but we will try to keep you awake. And the reason is brings a lot of expertise. And I think for the topic what I am honored to moderate today, I think this is one of the best panel what we could have. And quickly as it was introduced, so Ravi Kiranji, and why I'm saying this, because this is very contextual when we are talking about quality and affordability. And I'm going to also add accessibility as part of it, because that is also extremely critical as part of it. Now, he has seen innovation from both the side and also from how to make these drugs or molecules affordable and with a lot of quality. So welcome Ravi Kiranji on the panel. Also Pradeep ji, again very extensive experience working across and now he's as a CEO he is heading. So I think we will have some good exchange with Pradeep ji as well. And then Mr. Nikhil, who is the CEO for Entod Pharma, as an entrepreneur, I think he is putting all together to again make it affordable, quality, accessible drug in ophthalm and I think derma and many other disease area. So, so as we start this discussion, as we know, pharmacy of the world, that when we move beyond pharmacy of the world, there has been a lot of discussion. India is not only we can supply drugs after manufacturing, but we can also innovate in India. Also, and also for clinical studies and trials, because Bharat, I think we also is going to have data. And this is a very strong combination where we have data, science, and I will ask first Pradeep ji to you. In this whole value chain of pharma, when we see, it is not only about at the early research phase or during clinical trial, but there is a huge scope of innovation about innovation in India across this value chain. How you will react to this?
As far as innovation is concerned, most people would possibly look at innovation from the window of drug discovery. But as far as India is concerned, so what I was saying was, you don't need to look only from the point of view of drug discovery. As far as India is concerned, the accessibility, the affordability is more well served. Are made in a way that compliance improves, that side effects are lower. Those are the areas which I think India definitely needs and deserves. And focusing on high-end products is a small set of patients who will actually get value out of it. For most Indians, it's how can I get the drug which I need at a price point which is acceptable, and if it can be improved by way of compliance, it definitely helps improve patient management. So that's the thought I have.
So you talked also about is the whole accessibility piece, that ultimately whatever innovation is being made, in that whole value chain, it has to reach to a person for which this drug is being made. And what you have been doing in NATCO, you also, because you also have an eye on India, but also in Southeast Asia where you operate. So now in this context, how you see the same access issue and also the whole regulatory framework what we have in India.
I would like to start with the first word, the topic, pharmacy of the world, transforming the pharmacy of the world. India is already designated as the pharmacy of the world. Why it has been designated as pharmacy of the world? It is through innovation. Over a period, I would say 3 to 4 decades, many of the Indian global multinationals, which I am part of it now, by name NATCO, has been relentlessly working on innovation. Innovation of creating affordable and quality medicines. Just to give you a brief background about NATCO Pharma, not saying that there are other companies who are doing much equally good job. NATCO Pharma has got around 300 R&D scientists in delivering breakthrough molecules, first-time generics. Till date, NATCO Pharma has delivered 400 generics, first-time generics, in the space of oncology, in the space of gastroenterology, hepatology. Completely agreeing with what Mr. Patni is saying, but that for me, that comes as a second point. First of all, because in India, 80% of the people Patients are self-paid. As our earlier presenter also said, out of the pocket payment. From where the medicine will come? As you rightly mentioned, I was also part of my 20 years of my journey into the innovator, global innovator, where a medicine for a cancer treatment per month was costing 4 lakh rupees, right? That gives a lot of impetus and a lot of support to the patients, where currently we have a lot of support from the government, but earlier it was not having. Last 2 decades we have not seen. The current dispensation and the earlier dispensation was supporting them, but not the earlier ones before this. So I feel quality of innovator comes first to take care of the patients. To the patient. That's what I believe so far.
So rightly said. I think more and more, one is, as you rightly said, is bringing the generic the impetus on research and new drug discovery. I think this is something which also aligns with our Prime Minister's motto of now discovering in India,
Make in India.
and also innovating in India, along with making in India. So if I go to Mr. Nikhil, I think you have started from making in India, and now you have also started thinking about discovering in India. And so when you start a kind of a new entity in India and ecosystem, it's lot as a relatively newer group. Let's say if I put from many of the other established companies, how do you see this whole ecosystem of the world to innovating in the country?
Yeah, firstly, I would like to wish you all a very good afternoon. So talking about pharmacy of the world, actually, I would like to rephrase it as the world of pharmacy. We are there to create an ecosystem where we can, get involved in the R&D, in new drug development, new discoveries. So I think when it comes to, if you look to basically invest a lot more in developing those molecules that are required in India for certain India-specific ailments, such as tuberculosis, such as leprosy. That is, and now to get to that stage, the biggest challenge are the regulatory hurdles. The ease of doing business is something that is always talked about, but I think the ease of doing research is something that not many people talk about. And that's where I think that we need to work together with the government and with the regulatory bodies to see how we can fast track those processes. For example, say in the US, there is a system through which you can get it approved in India by getting a clinical trial waiver, where you don't need to do clinical trials in India. So there is a structure for that. However, when we do follow all the requirements of that of those asked to do phase 3 trials in India, which is lengthy, and that delays the new molecule from coming into India, and plus companies end up spending a lot more. I think this is an area that we need to change so that those molecules, the new molecules that we need in India, come very fast, and we give that benefit to the people of India. So I think that's so those are the hassles that us as a company have to go through. We end up having to do phase 3 and then sometimes even phase 4 and the whole lot. So we end up spending a lot more for this. Instead of that, if we can focus on new drug discovery, new molecules in India, which is the need of the hour actually, because there's a lot of conditions in India that are required here more than it's required in the rest of the world. So I think those are the hurdles that we need to overcome. and then we can create value in our industry. I think right now we are a volume-based pharma industry. We need to upgrade us an innovation-based industry, and for that our mindset has to change. The mindset of the regulator also needs to change.
The whole R&D ecosystem and a lot of biologics and chemistry in the country, we have a huge human resource, but still I think if you see in last 10 years, we largely depend on innovations which is coming from outside, and that becomes one of the reason to make these drugs costlier for us in India, right? Now, and you rightly said, for example, this whole regulatory system, phase 3 trials, post-marketing trials, but some of the solution addressing this. How do you see, if I ask Pradeep ji to you first and then followed by Ravi ji, that how do you see this, our aspiration is that we see new drug discovery happening in India. What could be some of the two or
Yes, I mean, we are talking about new drug discovery, but there are companies which under the present circumstances continue to do very well. They may not time in the world products which have been put forth. So there is definitely an ecosystem which has been created, and I would think that the ease of doing collaboration between the academic and the industry needs to go up significantly. I would think that is an important element as far as fast tracking and improving the resourcing of the drug discovery processes concerned. Is it that we are actually looking forward to? If it is applied chemistry, if it is not basic chemistry, if it is applied, if it can help improve access of a vast population to much better, technologically better drug, which can improve patient management. I think that's one kind of approach. The other kind of approach, which is more commercial, which is saying, let's come out with new molecules. In sync with what we require? Is that in sync with what we can afford, we can create? If that is not something which is near term, collaboration country.
Very rightly. In fact, recently, the way, if we see, for example, IITs, the way IITs have started kind of putting a lot of effort in basic and applied chemistry. IIT Kanpur, for example, is going to be one center where within engineering college, there is going to be a medical school. And they want to see how this engineering and medical, they work together when we talk about innovation. And there is one Professor Bandopadhyay there is doing some amazing work in IIT Kanpur, the kind of lab and the kind of exposure they are giving. And I think what Mr. Nikhil was saying, I was having a discussion with him and he says that our student do not know which disease area to take. Going here everywhere, but we need to prioritize that where our student need to work, and we have similar example from IIT Bombay, for example. They have come up with CAR-T solution, and I think this is where I think innovation and also the academic industry. You wanted to make some point.
The other place where, since you talked about IIT Delhi and IIT Mumbai and other such IITs, the story here also is healthcare is now extensively driven by AI, driven by big data, and that is where India has a wonderful edge. And if we could leverage that, I think we could really come up as one of the important centers of innovation in times to come.
Yes. We will come back on this point because this is AI and I think data is something where we would also like to hear everybody's point. But going back to Raviji, to you now, even when it comes to the whole channel where drugs are being pushed to the patients, for example. Now, in recent time when innovations are happening, and we heard one solution, for example, of payment, what are the other innovations you see happening or should happen in this whole value chain again? generic or branded, whatever is there. But how, coming from a very strong sales and marketing background, how do you see this innovation happening, whether it is in supply chain or apps? We see so many other things.
Well, as far as innovation is concerned, I'd like to address the first point which you asked, Mr. Patney. The two aspects. One is innovation in terms of creating a first-time generic. Second is aspects. As Mr. Patney has certainly mentioned, rightly mentioned, we are long way to go as far as new drug discovery is concerned in India. Because the point is that, for example, the company which I've worked, Novartis, for 20 years I spent there, the annual budgets for the new drug discovery is equivalent to Indian pharma industry turnover per annum. That's the amount of money they spend for new drug discovery. Yes. Whether it is possible in India? Yes, it is possible. There are two aspects. One is for capabilities, because a lot of innovation has happened so far in India. Most of the companies, including Akums and various other companies, where we have first-time generics, and we are very good in finished formulations and a lot of APIs also. Now, coming to the new drug discovery, what we require is the regulatory mechanism has to be eased. I think current dispensation is very much inclined towards easing the regulatory mechanism, which we have happened so fast, right? And the entire department is there for that. That is set now. The second thing, I'll 100% endorse the point raised by Mr. Patney and supported by you, academia. Academia need to be involved. As you rightly mentioned, IITs are involved in digital and technical side. I would urge, being a pharmacy background guy, pharmacy colleges should involve. Premier medical colleges we have, starting from AIMS to any of the medical colleges. For academia should involve a lot. If you look at any Western innovation, centers are involved while taking the new drug discovery out. So this is the thing, and ecosystem is there. Of course, a lot of finance is required. That support is also required from government side. And then all these three segments come together: industry, government, and academia come together. I think near future we'll also have a new drug discovery in India. Now coming to the patient access, I think at metro level, tier 1, tier 2 cities level, the patient access has been fairly good, right? I think, as you rightly said, which currently a lot of tech companies are working on, up in which down the line into the rural areas, tier 3, tier 4 areas. I think
very pledges, and I think I was reading somewhere in this current budget, I think there is going to be a lot of impetus on NIPERs. And NIPERs are going to be center of excellence, and I think once the budget is going to be announced, I think we are all set to see a big facelift at NIPER, and again bringing this pharmacy institution and also connecting NIPERs with, for example, IITs. IIT Hyderabad. Now these are the institutions has to work together, and the exchange has to happen. So I think we are going to see such changes as the focus is on innovation in the coming months and years, definitely. Now, the other issue which is also in for innovation and for research is and since I was having in another meeting few hours back, is on this whole patent system in our country. Right. As we are moving towards innovating process, all kind of patent, and this has always been a subject of discussion in India when we go ahead, how do we deal with it? Because in, let's say, in 10 to 15 years, there will be a lot of innovation, new drug discovery is also going to happen in our country. What has been your experience? This is a issue which is under a lot of debate, but as a country, we have moved a lot in that system. Whole system in India moving forward, and from innovation perspective. It's for three of you. Pradeep ji, if you can start.
As far as I understand, it's a double-edged sword. from point of view of where we are today, obviously a patented product is going to cost a ton. And a lot of times it is important for the government, therefore, which allows the price of the product to come down significantly. But as far as going forward is concerned, when you start developing your own part of your, because the kind of resourcing which he was talking about, where the entire pharma industry is equal to the cost of maybe 5 molecules which get created or whatever. If you are going to resource that well, you will definitely need protection. You need to evolve a much more robust patent process. That is what has happened in IT, for instance, and I think India is now starting to move in that direction.
Yeah, I mean, I think when it comes to patents, firstly, we need to think about the people in this country. If where we have only exclusive molecules promoted by exclusive companies, then I don't think it will help the Indian ecosystem and what we need in India, to be honest, which is cost-effective, high-quality medicines. So I think somewhere that patent system of the West doesn't fit into what we need in India. And it needs a rehaul, and a lot of the foreign MNCs will obviously have alternative views on this. But I think from being a company born and brought up in India, which then goes out of India and sees the scene, I think we need to have a different system in India for patents. Maybe give a company of X amount of years of exclusivity, and after that everyone else can also come on board and keep the price under control. So I have a very different view of patents. Yes, it's important to protect your intellectual property, but at the same time, I think we need to look at who we are trying to serve at the end of the day, which is our patients. And as long as we can put those systems in place, I think it can be a win-win for all.
Yeah.
Yeah, if I can add on to that. Being an Indian should not work in India, right? Because for the medicines, and at the same time, more than 50% are below poverty line. Still, some more years we require the process patent what we currently have. Now, as you rightly mentioned here, in India we have process patent, and all the drugs what we invent as of a follow the processes, and they stick to the intellectual property rights what has been governed by the legal authorities of India. So there is no doubt about it. Right? As far as India is concerned, we are sticking to that, and accordingly we are making the medicines using different processes. There are multiple processes we follow in inventing one drug. It's not like that Indian companies are investing less. Like, I was just going through my R&D team before coming here, because I just joined 1.5 years back in NATCO. I wanted to understand more before coming here. Even in NATCO, it takes anywhere between 2 to 4 years to come out with a first-time generic. And as I said, 300 scientists are working day in and day out, right? All under legal framework of India, regulatory framework of India, Indian law. So that is for sure.
So I think what is this particular point, this is a big elephant that always stays in the country, right? Sometimes we address, sometimes we ignore, but I think somewhere there has to be a kind of a balance. The way this whole ecosystem has to work, because I think more and more tomorrow each one of them will come up with novel molecules in our country. Everybody's interest for our population, as you rightly important. Now, the other issue is on quality, and recently we all have been hearing a lot about quality issue, and there has been, I think the government is also very keen and very sensitive at this point of time to take numerous steps to ensure that we ensure that the quality is there. Do we track and make an image of India when we are pharmacy of the world? There should not be any second thought on the quality of drug which is coming out of this country. Now, what is your take on this very important burning issue at this point of time, which is on quality?
So as far as quality of the drug is concerned, it is non-negotiable. Expected. You cannot play around with quality of the drug. And I believe Government of India did think of taking out a regulation which talked about bioequivalent studies so that any product which is there in the market has been tested and found to be equivalent to the original molecule. So quality of the drug, as far as country is concerned, you will find of the various samples which have been picked up by the regulatory agencies, around 5% still fall short of what it should be. I think that's not acceptable, and we should try and ensure that no matter what regulatory system is put in place where an inferior product is never made available to the patient no matter what. That's the take I have.
I'd like to add on to that particular point. Coming to again Natco Pharma in regulated market, all manufactured in India, in all FDA approved plants. So the medicines what we manufacture, 60% South America. That's our major business. Indian business is only 40%. So that shows the quality. Whatever we produce, it has to be equivalent to the innovator and it has to be slightly better. Patni mentioned. So there is no doubt, any Indian organization, we should not doubt and we cannot doubt the quality. I mean, all the healthcare physicians will endorse it.
Yeah, I mean, I think, I believe that in the next 5 to 10 years, the regulatory framework where, will be kind of, in a way, made to give a lot more importance to quality issues. For example, I believe that the existing Drugs and Cosmetic Act will soon be replaced by a new bill which was introduced in 2022. Medical devices, in a much, and also hospital equipment as well. That will also probably in the future mandatory, like on primary, secondary, and the tertiary packaging. Maybe we also may go into the area of pharmacovigilance as well, which is kind of lacking in India compared to the West. So a lot of these regulatory changes are going to happen anyways to ensure that the world of pharmacy becomes much more quality conscious. We are producing, I think India accounts for almost 20% of medicines globally in terms of generics, and that is going to increase. So it's not that, we are faltering when it comes to quality. I think we have a very good history and track record in terms of quality, but there is also a long way we can go to ensure that when we become that $130 billion market by hopefully 2030, we are in a much better position to answer to the rest of the world, including the US, when it comes when it comes to quality issues.
Very rightly said.
Small correction, 25% of US generics are from India and 40% of global generics are from India. That's a small correction.
That's why we are known as pharmacy of the world and pharmacy for the world. Now, I think we have some 10-15 minutes left, and I don't want to see that some of you should take some rest. So why not take this opportunity? And I have few questions, but I'll take them on hold, and I just allow you to ask questions to this wonderful panelists. So just want to add that question. So who is going to be the first? And yes, please. I see a hand there. If somebody can pass on the mic, please. I think use my.
Hello. My name is Piyush, and I was just speaking just before the session. So we see that there are a lot of companies who've started pharmacy medicine delivery apps, and now they're entering into the segment of delivering their own medicines. There are certain pharmacy stores who've now created their own medicines, like those generic drugs, their own molecules, and branded their own. What's your take on that? And where do you see these medicines, the pharmacy industry headed? houses taking over the whole pharmacy setup, of doing their own manufacturing and having their own factories, or we still would be looking forward to the world-renowned companies and doing the research in India and taking it outside of India? It's to the entire panel. Anybody can answer that.
I'll start. You're referring to online pharmacies, if I'm right. Online pharmacies.
Mix of both, because there are, I don't want to name specifically,
I know,
but there are brands who like medicines as well.
Yeah.
Not allowed to take names, so I'll just keep it.
I do understand that. Online pharmacies are, according to me, are going to stay. Now that our pandemic lockdowns has helped them to establish their setup, and it's going to stay. We have to bear with it. Just it's not going to dominate, that's for sure, right? Like, you know, I'm sorry to use that word, don't want to use that. Brick and mortar shops are never shut, right? Our supermarkets, kirana shops are not gone, still there. Like similarly, online pharmacies are going to continue, maybe they will take, and our regular pharmacies will continue. It can be in China pharmacies, it can be in individual pharmacies. Now coming to the medicines, what they are manufacturing it and selling on their own. Most of them are over-the-counter medicines, not the prescription medicines. If they are selling prescription medicines, they are under schedule and they are under regulated. And they have to have we have to go with the flow, according to me.
What you are saying is very true. A new business model is obviously work in the healthcare sector. I can tell you it's not just pharmacies. Doctors also have their own manufacturing brands. They get it manufactured and start selling it themselves, a group of doctors. So that's a business model which is emerging. One needs to wait and watch. And as he rightly mentioned, the quality of the product is an extremely important determinant, and the trust which the patient has on that versus what a doctor prescribes would obviously make all the difference. At the end of it all, the story revolves around what kind of, if that brand can build that trust, it will be a disruptive model for sure.
I think to add to that, yes, there are, I think the bigger concern is where you have a group of doctors or a hospital chain trying to have their own brand, set up their own pharma company. I've always been against that. I've said the point there is that it all comes down to what quality systems a pharma company has in to maintain the quality, to maintain quality of the batches, inter-batch quality, everything, and I think it's difficult for a hospital setup to actually monitor it, because I work very closely with hospitals, so I know exactly what kind of goes on. A lot of the time, they just want to get into the business benefits that they see, or they get a lot of private equity funding and they don't know what to do with it apart money into starting their own kind of pharma company and stuff. So I think that is something which is disruptive, and actually more than disruptive for us, we feel that has the potential to compromise in terms of the long-term quality assurance. Definitely we need to think about it. We need to kind of more actively debate on it. Online pharmacies, yes, I mean, that is the way forward anyways. I mean, that's going to happen. As one of the panelists said, that it won't dominate the scene. So that is, in a way, that's a positive thing, because that will improve access of medicines to patients.
Thank you, panel members. Yes, please.
Hello.
And I have one very simple question about quality. When you say generics and branded, now the same company is providing a generic molecule in the market with a branded So I would not like to quote the examples of the companies, but these are big companies like Cipla, Ranbaxy and GlaxoSmithKline Beecham, who have the branded products in the market and who have generic products also in the market. How do you evaluate this, that the quality in generic and the branded would be the same? One, because the cost difference is there. And in this entire process, the person who is making money is chemist, because the branded molecule and in the market both have the similar price packaging. Whereas we all know, we are from healthcare
Your
industry.
question is clear. If you can just also introduce yourself, please.
Sorry, I'm Vikas Chhabra. I'm from Arohan Healthcare Services based out of Gurgaon.
Okay. So Pradeep ji, you would like to take this one?
So I would think that these are different business models of various companies, and in the normal course, if a company is of that particular stature, that particular conscious about what it needs to deliver, then the quality between a generic and a branded should not really be.
100%. I agree with him. I have worked in a couple of companies whom you have mentioned, where they have branded medicine also, we have generic medicine also. It should not differ. Quality wise, it should not differ. Yeah, the model I am against is, instead of passing on that economy, because see, when you're creating a brand, it attracts a lot of investment. You know it very well. That investment, that's why the branded medicine costs slightly higher than the generic. Currently, patients are not getting the benefit when they are going for a generic. The middle person is eating a lot of money. That's why personally, I don't believe in that. It should not happen. Same company should not manufacture and or sell it.
I think when you're comparing generic and branded, yes, there will be differences in pricing, but what you need to look at is the R&D investment that the innovator or the first, second launching company in India has, all the investments they've made to launch it in India in the first place. So they need to get a recovery from that. Like if I invest in a new molecule which comes from which is approved by the US FDA, for example, in get the product phase 4 clinical study. So I'm investing in get that molecule to you first. So there has to be a difference in pricing. Whereas if someone comes number 4, number 5, number 6 and launch the same molecule, they don't have those expenses. And that is why the price differences come. Obviously, after a period of time, the prices will normalize to what the generic kind of company would actually charge. But initially the price would be high because the company is spending more on the R&D.
One thing which I think all the panelists summed up is that there should not be any doubt in terms of the quality of the drug, whether it is branded or generic, because any drug what comes to the market, we assume and we believe that it has been approved, it comes from a kind of approved lab, and that quality compromise will not happen. Price is some point and strategies. I saw one hand, yes, please.
Hello, I'm Dr. Nitin Vaikar. I work with an early cancer detection organization, Hare. My question is slightly away from pharma. I am talking about the last delivery point, up to the patient. So there is a very, very important link, that is the doctors. And there is a between the doctors and the patient community. What trust issue?
I think number one, I think the pharma industry needs to work very closely with the medical profession in creating a centric approach. Our industry has traditionally been a doctor-centric industry. Somewhere because of that closeness, the patient has lost trust in in everything. They've lost trust in doctors, they've lost trust in us as well. If we work together as one for the interest of patients, for example, we were discussing a bit earlier on about having the concept of kind of patient groups, which is in that turning do all these things to actually build trust with the end user, which is the patient. So patient-centric is the way forward as one team.
Yeah. So I think, in healthcare, and I'm going to kind of conclude this after just summarizing the discussion, but patients in India has, the consumers are patients for any pharma, always been doctors. Now, consumers have started becoming more and more aware, educated, right? And this, and they need to be more educated because they cannot be a passive kind of participant in this whole healthcare ecosystem. And that's why when you shared about Nikhilji that, there need to be awareness, patients need to be together as a support group. And I see, let's say, Indian Cancer Society representatives sitting here. They have been, we need many such organizations who, including yours, who are working on the last mile with patients, kind of guiding them, giving them a choice so that they are not silently, accepting whatever is being given. It's their right to ask. In current system, sometimes we don't ask, and we don't ask because we only trust one doctor, which is, we all do is Dr. Google, which is not right. And it disturbs sometimes a physician when we enter and ask questions which may not be relevant. So it an area that we all need to dwell upon. So I think our time for this session is going to end. So I'll just summarize. Is we need in India a system for a short term where we can ensure quality of our drugs, a very strong regulatory system which doesn't delay access, because otherwise we will continue waiting. Something has been innovated somewhere, and we in India, we are waiting for that innovative therapy to come in terms of accessibility, affordability, and quality on all the three aspects. Second, I think the industry academia collaboration. And very rightly, Ravi Kiranji, you added in that industry academia, we still sometimes, miss out pharmacy institutions. We go to tech colleges, all these institutions, but I think the pharmacy institutions also needs to join in this whole conversation. So this collaboration, this partnership is very critical. Third point was that the innovation is not required only in drug discovery, because that is going to happen maybe after 10, 15, 20 years. We don't know when that is going to happen. But what is also important to have innovation in this whole value pharma chain, starting from what we are hearing in the previous presentation. The supply chain system, it could also be the digital technology through which patients at last mile gets access to doctors or treatment. So it's the cross value chain that is needed. And the most important is that at no and also kind of remove this kind of confusion in our mind that whether it's a branded, generic, the quality in this country, when it is approved by our regulators, our system of medicine here, I think that is definitely at par. There's no issue. But otherwise, we will, when we are thinking about moving beyond our tag of pharmacy of the world, we may not be able to do that. And I think that is a very critical point on quality that I think we are doing great. So I think with this, I will thank each one of you. It was an honor to be with you, and I always say that these kind of meetings also allows us to meet, and it also thanks IHW Council, Kamalji, for bringing this platform with always with new topics. I think it's not always one topic, and the kind of a diverse set of people who come meet and we all deliberate. I think This is something for last 3-4 years, I think great work IHW Council is doing. And I think, and not only in Delhi, it's moving all around. Very happy that you are in Bombay. And I think a lot of audience also get chance to participate and meet. Today was not a very favorable day for many of us in terms of traffic and all, but I think it's an important day. And I was telling jokingly to Kamalji that who followed whom, but finalized before, so our Honorable Prime Minister followed, wished that he could have come here. But I think, thank you all of you in this session after lunch, being very awake and also asking some of the very relevant questions. Thank you, and we will wrap it up and give it back.
Well, thank you, sir, for sharing your wonderful insights. I would now like to invite on stage Mr. Vivekanand Mishra, Vice President, IHW Council, to present the mementos to our esteemed panelists. Mr. Prabhat Sinha, Mr. Ravi Kiran N, Mr. Pradeep Patni, and Mr. Nikhil K. Masurkar. Picture. Very much once again. Ladies and gentlemen, we shall now move on to our fifth panel discussion of the day, which is based on digitizing healthcare for universal care through better delivery and health outcomes. And to moderate this session, may I please invite on stage Mr. Rennie Varghese, CAO Unit Head, Zainova Shalby Hospitals. Let's welcome him with a huge round of applause, please. May I now invite our esteemed panelists on stage. Let's welcome them also with a huge round of applause. Mr. N. Department of Public Health and Family Welfare, Government of Maharashtra. Mr. Hiren Ambegaonkar, Group CEO, Surya Hospitals. Dr. Swapnil Kharnare, Assistant Director Administration, PD Hinduja Hospital, Mumbai. And joining us virtually is Ms. Urvashi Prasad, Director Development Monitoring and Evaluation Office, Niti Aayog. Let's welcome our panelists with a huge, huge round of applause, please. Sir, over to you.
Good afternoon to all of you. Or is it evening? I'd like to tell you a small story which happened 23 years back when I was a student. I was attending a conference where a panelist had raised a question. In Chennai today, and I get transferred to Delhi next month. I go to Hospital B in Delhi, I have no access to my previous reports. So all 23 years, it's happening. Today, we have the likes of DigiLockers, the likes of ABBA coming in. In this background, let's start our discussion. So I would like to start with Ms. Naveen Sona, IAS, Secretary of Health, Government of Maharashtra. How do I'm not asking the government look private players to contribute to healthcare?
Yeah. So good afternoon, everyone. That's a very important question. In general, if you see, as you rightly said, the Ayushman digital health mission. So that mission itself gives a hint of things to come. Now, what I mean by that is, if you look at the digital health mission, there's an example as a public policy intervention that is not restricted to just the government or state institutions. So this is a big change which we are seeing in the approach from the right from the top, from the honorable Prime Minister's level and Union Health Ministry and the state. The focus is now a very comprehensive system building approach. This is something which has happened as an evolution of the other the state, and now it's gone across different sectors. The second thing would be like UPI. So that UPI is an interoperable system. So on the same way, I think this is a very remarkable change in the way health policy. So this is a framework, this is a platform for the entire health community build upon. So when we look at digital electronic health records, basically the ABBA is basically a cloud. Records and medical records and interoperable between private and public. So where in the coming future, this is going to open into a platform where anybody is going to be able to which the government framework gives the guarantee of the framework for its security, and it's a consent based. The changes are going to be done, but apart from that, private sector, and there's a acknowledgement that all the knowledge and innovations and the newer technology or newer practices are not so much knowledge and so much investment is happening in private. So I think we see a big change where there is encouragement of public and private partnerships, not fora like this, or it could be through corporate investment, CSR, and there's of course a big focus like in Make in Maharashtra, Make in India, to bring in technology like health devices or consumables, and the public systems. And definitely, I don't think we'll be able to ignore the wealth of knowledge and experience which is there in the private sector.
Thank you, Mr. Naveen. We have just come out of a major disaster. So I would like Dr. Hiren to talk about cause in India.
Thanks, Rani. I would say the pandemic was a great equalizer. Be it the rich or the richest of the rich or the poorest of the poor, they had a similar problem. Everyone was scared for their lives because of the unknown. And not functional. Smaller nursing homes are not functional. So there was a big rush towards finding a hospital bed. And even the rich were finding it difficult to get a hospital bed. Poor were also having a problem. That's where technology actually came to the forefront. And here on public forum, I must appreciate the efforts of the government here in using digital technology, digitization, to increase the healthcare all across. In Mumbai, we saw the war rooms which were created. A phenomenal success. Mumbai didn't suffer the same calamity as many other cities where people are running pillar to post trying to get a room. In which hospital, and people from that ward were only asked to go call the war room, get the bed details and go to that hospital. That made admissions extremely easy. The COVID app, which came up so fast, was the backbone why we are not facing the fourth or the fifth COVID wave now, which is spreading all across Europe and China, is because of our fantastic vaccination from the government and the like. Arogya Setu app, similar thing. So basically, pandemic gave technology a fillip. And another thing, it taught the to the hospital for a small reason. Video conferencing, telemedicine jumped it. Even general practitioners who would treat fever and people would go to the general practitioner's clinic started using video conferencing and telemedicine to go there. So the number of people going to the doctor's clinic and exposing themselves to further infection was reduced. This was one of our biggest learnings from pandemic, which has
my question to Dr. Swapnil would be, of course, we are nowadays talking about a lot of insurance patients coming in, but still there's a big gap where the out-of-pocket expenses for the patients is huge. So if you can elaborate on that typical gap.
Good evening, ladies and gentlemen, and good evening, Mr. Yannick. Consists of two major portions, right? One is your inpatient care and your outpatient care. Though, as on date, we have insurance coverage, but majority of the insurance coverage, be it the government coverage, what we have through Ayushman Bharat, or what we have the penetration as on date for the private insurance companies, is one part of the healthcare which forms about 70% of your out-of-pocket expense is not covered, and that is your outpatient services. Your outpatient services consist of your consultations, your diagnostics, and your medicines. 70% expense, 70% of your expense is going into medicines, and none of the insurance company on outpatient basis is covering this medicines. The statistics says there are around 2 visits to a hospital On an average, that person spends per visit somewhere around 1400 to 1500 rupees, and out of that 70% is spent on. So now what I'm saying now, this figure may look small, but if you take it, free medicines, free visits, free doctor consultations, this is a huge. And if you talk about somebody staying in a rural area, if I take about taking about 6.7 to 7% of his income, of his total expense that he is going to do. So suppose he is going to spend around 100 rupees of his expense, 7 rupees he is going to spend for outpatient services. You can imagine that 7 rupees he could have invested either in food or he could have invested in education of his children. For the IPD level, as on date, even now is 6 to 7%. So I work in the rural areas. I work at Hinduja Hospital. At the same time, we have a program which is working in the rural areas. So about 15 years I've been doing and visiting this area. There's a place called about Jawar. It's a tribal village about 150 to 160 kilometers from Mumbai. 15 years back, this particular place had called packet of wafers. If you have heard Balaji wafers, in the interiormost part of the rural tribal area, Balaji wafers was available. Coca-Cola and Pepsi bottles were available. Dish TV, that is the time 15 years back, only Dish TV was a popular dish antennas which were available, that was available. But getting a crocin, that person had to travel 15 kilometers to come to the Taluka hospital because the medical facilities were available only in this place. So what we are talking is about out-of-pocket expenditure. And all the private hospitals and the other hospitals sitting in the room today, we know we have one dedicated person in the hospital, all of our hospital, who goes every day to the patient asking for outstanding. Do you agree? All patient for outpatient. Now I meet around 5 to 6 patients on a daily basis for outstanding, and it's not that they don't want to pay. It's because either they don't have a proper insurance or they don't have insurance at all, or second, if they have an insurance, it is not adequate. Expenses are going in terms of around 10 and 12 lakhs. My insurance is about 4 or 5 lakhs. That's where Sreni is what is happening as on date. That's what we are seeing. Push us into further poverty, and like this now Dr. Hiren told us about the expenses that happened during COVID. A lot of people, there's no business, there's no job, illness is coming in, and a lot of people have been pushed into the poverty. So that's how people, I would like to appeal to everybody that we need to relook at our insurance. We need to make sure that more and more people get into insurance. Government from their side is starting actually facility. I guess more and more people, once they take up insurance, this out-of-pocket issue should be addressed.
Yeah, during lunchtime we were talking about one more thing, the same gap. If a SIM card can reach so anybody from the insurance sales side sitting here, you have a huge opportunity. Coming back to Mrs. Urvashi, am I audible?
Yes, I can hear you. Can you hear me?
Yeah, we can. So a primary question. So from a policy level, is there any plans of everyone talks about healthcare in the metro sector, tier 2 cities, and we talk about tertiary care. So what can be the government's focus on primary care?
Yeah, so in fact, if you look at even the Ayushman Bharat program, it has two major pillars. Often we end up talking mostly about the insurance part, which is the Pradhan Mantri Jan Arogya Yojana. But if you look at the first pillar, that is actually on providing comprehensive primary health care, which is through the health and wellness centers. And around 150,000 of these health and wellness centers have now been set up across the country. Now, the next challenge for us is to really operationalize them fully, because these centers are supposed to make a departure from the primary healthcare that we provided in the past, which has been very much focused on reproductive, maternal, child health. And we're now saying that we will also focus on aspects like screening for non-communicable diseases, promotion of healthy living, wellness, integration of Ayush. So basically, our next focus really from the government's point of view is to fully operationalize these health and wellness centers, to make sure that they are actually delivering comprehensive primary health care. Also, we are looking at investing in or encouraging states rather to invest in setting up public health cadres, and so that these cadres can focus exclusively on public health related activities, health promotion, because as we know that in most states, we have a medical cadre. There is a very cure focused approach to health. And we actually need to move towards public health and prevention, and also primary health care, which also has elements of early detection and screening and so on. So we're also trying to incentivize states from Niti Aayog to adopt public health cadres, and to set these up as well. And also on the human resources side, more broadly, we are looking at promoting different cadres of health professionals. So going beyond doctors and specialists, because everything in primary healthcare or in public health doesn't need to be performed by a doctor or a specialist. So we are also trying to build other cadres of health professionals in different states across the country, and also, of course, in doing so, addressing the rural-urban disparities as well that we face currently.
Thank you. In fact, you have actually covered my second question also. Coming back to Mr. Naveen, early diagnosis, especially in the case of NCDs, reduce a lot of mortality. So, what would be your inputs on that?
I think this approach is in focus, but the actual concrete inputs on this are happening now. As Niti Aayog, early detection and screening, apart from the wellness aspect. So these two are going hand in hand. So I'll give you an example of the kind of scale of operations in Maharashtra. So we are having now, as on date, about 10,770 health and wellness centers as focal points. So earlier it was just a primary health, center. So now this has been recast in the wellness mode. So what we mean by that, it's not again the same doctors who are doing it. So we take care of this. So we have got about more than 8,000 doctors on contractual basis. And they have been trained to look at this from a different approach. Do home visits. The focus is the household and not the walk-in of kind of an active screening mechanism where the vision prevent diseases from reaching the point of treatment, but go into preventive healthcare. Wellness is one larger aspect, but the focus is a big shift in governmental thinking is to preventive healthcare. We realize the huge the gap in per capita GDP, kind of investment which is required to raise the standards of public health care, finally taxpayers' money. But if the same focus is put on developing the and the loss of man days and the loss to the economy, the productivity, everything's going to have and that money would be not spent on curing diseases but in prevention. So having said that, we have done one more very innovative thing with the last few months under the leadership of our Honorable Health Minister, Mr. Savant. So we have taken up a very massive screening campaign, just focus on women above 18 years of age. Screened close to 4 crore women in across Maharashtra. So the focus is we identified people with precancerous stages. We have looked at cardiovascular problems. We have got looked at very simple things like anemia. We have run blood tests. People have been now. We are in the second stage of that, where we are sending them to the going on. So it's a big shift. I think the governmental policy is also looking at screening of not just sample. Public health it's a very statistical approach, right? So we don't have a picture of the state of the society. How healthy is the society? What is the disease load? The earlier approach was just a statistical thing. We do random sampling and we have slowly the shift is that let's invest in especially NCDs, which is a huge aspect, as I think which we realize is the comorbidities in COVID were actually a very deciding factor. So we can't just ignore comorbid conditions, be it hypertension or diabetes. It's a lifestyle issue. It's an economic problem also. The nutrition.
But unfortunately, most of us suffer the ostrich syndrome. And under the head and say the storm is going to go away. A regular health check is one of the mandatory things which one should do. Medical claim policies. How many of you know policy owner can undergo a health check free of cost 2 to 4 years from when you take your policy, every 2 to 4 years free. But people and the said that only 25 to 30% of their policy holders undergo the health check, which is there for free for them to do it. And one of the reasons why they do it is their unfounded fears that, oh, if I do a health check and something comes up in it, my premium will go up. But are you taking a policy for your premium or for your health? What's more important? A young man in his 50s gets a PSA positive, which is a 100% cure. A woman who does a pap smear in a regular check finds minor abnormalities, she's cured for life in the early treatment. Vital. And the government has taken steps for it, like Naveen sir said about mass screening of NCDs. The new clinics which have started with 149 rupees testing for tests, which is coming up soon. This is the thing. Health checks have to be a priority. There's no second point to it.
Thank you. Coming back to Ms. Urvashi, over the last few years, the national government had been doing a lot of things in bridging the gap for skilled manpower in healthcare, especially and all those efforts. If am I audible?
Yes. Can you hear me now? Yeah, could you just repeat the last part of your question?
Basically, my question was the government efforts to bridge the gap for skilled healthcare workers, the contribution by the National Skill Development.
Yeah, so I think, when we talk of skilled healthcare workers, so I think there's two, major tracks on which, work is going on. So one is, of course, we are focusing on, getting more quality doctors and specialists. So that is one dimension of it. And getting them equitably distributed. I think that is really the government's biggest challenge, because there are certain states, there are certain districts, certain urban centers where you don't really have a shortage of, skilled doctors, skilled specialists. But then there are other parts of the country, especially the rural and the remote areas, where it is really very, very difficult to, place these skilled, highly skilled health professionals. So I think that has been a long-standing challenge for the health system, and that is something that we are trying to address on a very urgent basis. Of course, we are also trying to look at other means of augmenting the health workforce, such as through use of technology, and use of technology for training purposes as well as for reducing the mundane tasks that health professionals need to undertake. So how we can better use artificial intelligence, how we can better use other types of technologies in supporting the health workforce. That is another dimension that of course we are looking at. But then, as I said, apart from doctors and specialists, we're also focusing on other cadres of health professionals. So, your nurses, your nurse practitioners, that is a cadre which is, very well known in some other countries like the UK and others. And in fact, a lot of the primary healthcare is managed by nurse practitioners and not actually by doctors or specialists. So even in India, we are trying to now look at these other cadres as well. Of health professionals, and sort of build their capacity, and also make sure that there are career progression opportunities as well, for the different types of health professionals, because otherwise we see a lot of movement out of the country, of qualified personnel. So that is also an issue that we're trying to address by looking at career progression, looking at salaries, incentives, and so on.
Thank you. Since we are running short of time, I'll restrict only to one question to the panel and then maybe open the again a restricted two questions. The data privacy and the need for consents from patients, Dr. Swapnil.
Absolutely no doubt. The first thing why a patient comes to a doctor is because of this one single word called TRUST, trust. So a patient comes and opens up to you and gives you a history about his illness and opens up to you and tells you everything. The one thing that he knows is this information is not going to be shared with somebody else, and nobody else is going to utilize this information for some other gains. Okay. So that's why it's very important point of view also. Whatever information shared between a patient and a patient's doctor is supposed to be confidential. So there is no doubt without consent, no other information has to be shared. And at the same time, there is no way we can breach this contract, which is a sort of an unwritten contract between a doctor and a patient, that there has to be breach of. Because of going into a lot of digital media now, what we see is the chances have gone high. You must have heard about a couple of months about there was so-called rumor which said about a particular hospital, the data was breached and a lot of data was in the market outside, like was a malware had come into the system, and because of which the data was breached. Okay, it's a very threatening, it's a very dangerous trend. So it's very important that whichever hospitals are going into the digital way, are going into teleconsultation, all the regulated managed, and obviously yes, you have to get the few days back we just have introduced something called as a WhatsApp reporting system for Hinduja Hospital. So all your reports can be given on the WhatsApp. So when we are sending the report on a WhatsApp, it has to be consent of the patient that he wants to see it on a WhatsApp, he wants to see it on an email ID. Layer of protection, password protections, OTPs on it, and only then it can be shared.
Thank you. Any questions from the audience? We as a panel, we'll try and answer it. If not answerable, one of our HR team will get back to you, hire you. Any questions? I have this mic.
Sorry, sir. Am I audible? Hello to the judges panel. I'm Dr.
Hello.
Neha. I belong to the ICMR team. I have two questions here. First is nowadays we are trying to promote the drone technology, medicine, and the digital media to promote the same. And second question is, what are the developments over the cyber security that the digital world is trying to make?
One thing though I am not in a position to answer because that doesn't come in my profile. But one thing I can tell you, my IT budget has more than last 3 years since the pandemic, because of exactly what Dr. Swapnil said about having the firewalls and data protection. Because now once you are on digital platform and your HMIS, you are always at a risk for hacking and your data being taken on ransom. Earlier with, we had this scare where one fine day we got a message that your system is breached and you don't give us XYZ amount of Bitcoin. And that would have meant a disaster for our hospital. Fortunately, we were managed to extricate ourselves from that particular situation. But that made us understand after that, every hospital practically, they will agree with me, has increased their budgets on IT and cybersecurity to prevent such similar situation.
Add to that answer. One is again the inevitable digitization of, the health records. At some point of time, we are going to get some part of the chain to be digital. Regarding the tele aspect, how are you going to interact, as was rightly said, post pandemic, telemedicine, even government is doing. So we are doing a lot of teleconsultation for remote areas. So where the specialists are in, better locations, and we are webcams, and so we are able to actually do it. Is a platform like WhatsApp or a commercial openly available, sensitive as patient data, is a call the whole larger medical community has to take. Why I flag this issue is, again, I'm coming back to, so when we are doing a QR code payment, the QR code over your mobile. 10 years ago, I wouldn't dare do payment on my mobile. Quite casually through our mobile, we send QR codes, and it's accepted because we do not question the security. The same way, the digital mission is the records, if that public cloud, that public spaces platform is adopted by the entire health community. It could be LMIS, it could be HMIS, it could be even individual doctors who are on private clinics or private practice. So take a call. I mean, is it worth spending that budget or trusting a public network? So this question is going to come up quite soon, because government is investing a lot of taxpayer money on building that system. We are in the early phase. We are in these platforms are going to come up, and a very ubiquitous interoperable system would be available for people to use, like Aadhaar or like UPI. Smaller hospitals and so on. The drug delivery part, I mean, naturally we have very remote areas like, Gadchiroli or Nandurbar, where, doctors have literally have to walk barefoot for, hours to go and reach out. So definitely, that's a wonderful option. I mean, that there's no definite policy on that, but definitely I think that will be a need of an hour, especially in emergency situations. I mean, in cases of outbreaks, cases of disasters and so on, I think the drone could be.
Thank you.
Hi. So, in the past couple of hours, we've talked about medicine, clinical medicine, pharmacy, insurance, lifestyle, but there is still a pillar of medical transportation, right? The ambulances per se. Now, with 5G being integrated into ambulances and these ambulances being used as remote monitoring units, are there any plans of hospitals in leveraging these ambulances to take healthcare out of the boundaries and geography? Now even SIM cards are being delivered to the remotest of the locations. Why not diagnostic services or primary healthcare per se?
In fact, I have met two companies in the last 1 week which promises about transporting a patient maybe from Agartala to Bangalore, reaching the location within 45 minutes of the call. So you don't need to have an ambulance on your own. That if an ambulance is reaching a remote location, if you're a primary provider, you can always talk about linking your services to it. You already have paid manpower for it. You just need to things you want to convey? Thank you.
I would just like to understand your question. Why the ambulances that you mean to say the mobile health units or ambulances? Okay,
Ambulances.
can't hear you.
Right. So the question was ambulances being used more than just a transportation unit, right? To mobilize and maybe modify these units and use them as remote monitoring units.
Yeah, so today in city of Mumbai, you go to city of Hyderabad. Hyderabad was the first city to start ambulance services. Okay, integrated ambulance services. Okay, Apollo today has an integrated Apollo service. Actually have a call center, and this call center is actually monitoring. So there is a distress call which is available where you can dial a particular number, 3-digit or 4-digit number. When you call that, they will actually identify which place you are. They will send an ambulance closest to you. The ambulance has a monitoring device which is connected to the hospital, which will actually monitor you through. So it's like a ICU on wheels, and you take it to the nearest hospital. Okay, so this is available now. Yes, like you said, and like Mr. Reni said, there's a lot of aggregators coming in. Okay, but the model has not been successful. Okay, the model has still not been successful, especially in the city of Mumbai. It has not been, but the success has been seen specifically in places like Hyderabad. Hyderabad has one of the best. Chennai has one of the best systems. As far as the other, I was talking about the mobile health unit system. NRHM, actually the Rural Health Mission, actually has mobile health units, and those have been run in different areas. So in that place, you don't need to have a brick and mortar model where a doctor and a nurse and a medicine is available, or a diagnostic is available. The diagnostics are available. You can do a CBC, you can do a test like your random malaria test, or you can do your random dengue test. Okay, UPT test can be and also can be seen on that side. So those NRHM actually has those. Again, less, like you said, but more needs to be done. But we have begun on the journey. It is there. It is there available.
Thank you.
So I'll take the last question from this young lady who asked for the mic first.
The spelling is LATE, and that's the reason probably I'm getting this chance late. So first of all, thank you so much. It has been wonderful and very knowledge-filled evening, we can say. So thank you for that. And I'm very much happy with my company and love my job. So I'm confident you'll answer my question. Hence, no need to hire me. Okay, my question is, since morning we've been hearing that, okay, of anything, and prevention has been emphasized since morning. So in the field or in the society we observe, one is prevention is working in isolation with something alternatives, like Baba Ramdev came into the context in the morning. Then diagnostics are working somewhere in the silo, in some areas, the research, everything is going on there. And then therapeutic area where hospitals majorly play the roles. Innovations happen at the pharmaceutical level and all those things. So how are all these aspects or the area perspective, or maybe from the hospital's perspective, so that we get the best of it and provide a comprehensive healthcare to the patient? Thank you.
Yeah, that's a big question actually, but I think, I mean, this our co-panelists can definitely shed more light on this also. The issues you have raised are, it's the entire spectrum of what it, disease free. So I think the healthcare terms, it's a kind of a demand and supply market, for lack of a better word, and market I use it in the economic sense, not in the commercial sense. So there is a demand for illness, but is there a demand for wellness, which is what we are in a conference which has wellness inbuilt into it. So are people really seeking out, are they willing to pay for advice for wellness? The developed nations are probably at this game much earlier. Now with the post-pandemic and the thing, so people are probably going to pay for wellness. So I think it's a big, change in the way we consume what we call health-seeking behavior. So it will be the health-seeking behavior is not going to be restricted to reaching out to doctors, but to so many other people. So you'll be surprised, like, yoga, which is also, it probably cures, maybe mild hypertension. So this is a larger aspect. That's why we have built in Ayush as part of the thing, and we are looking at early intervention. When I mean early, so the next generation is also going to be a big player in this scenario. What you're saying, probably the change in mindset will come if we are working on our 5-year-olds today, or our 10-year-olds, or our 15-year-olds. By the time they are going to reach the state where they are going to have their out-of-pocket expenditure go into medical expense, probably that's going to come down. And build this as a cultural change, as a nation, as a country. We need to build this approach into the upcoming generation and build this as a health-seeking behavior, and then these silos will break. That's what we look at it as. There is always an investment in gaining the knowledge, or there's corporate aspects to it, but as a community, we are all here only because we want. Having said that, I think we are all on the same page, state and private sector. And let me tell you, I mean, as a company in healthcare, I don't think the market is going to go down. I think it's going to go up, because more and more people are going to come into the picture of wellness. Right now, that fragment is only those people who are ill are coming into the sector. We are going to have the entire population coming into and actively seeking wellness and health. I think we are starting a completely new generation of what is healthcare. I mean, I think that's one of the reasons why we are here. That's my personal opinion.
When 3 words: wellness, prevention, and treatment. Everyone considers wellness as prevention. It's not. See, when we talked about health checks, we are only doing preventive, so that you are preventing an illness from becoming a major illness and causing you problems. Wellness has to being healthy, fitness, eating healthy food, yoga, all that is wellness. So another thing is what people are now coming in the latest things is genome sequencing and finding tests when the babies are born, whether this baby will have any illness in future. All that is predictable. Now, all that comes into a thing which is a newer thing in healthcare. Future will hold a lot of extent. But wellness and prevention are 2 different things.
What I understood together, your wellness, your preventive medicine, your curative medicine, it is the need of the patient. There's no. And the typical example you have is COVID. When COVID came, there was a need to attend to patients need, and you saw diagnostics to the vaccine guys, to the vaccine dispensers, from police for lockdown. Everybody came together and they gave us what we actually could see in those 1.5 years. Okay. So patient need is something that is going to happen. Okay. So for these watches which are going to measure your steps. Okay. That's come because need. Majority of us want to see how much I am walking. Medicine need is something that patient is becoming more aware. The more awareness happens, more things will come up and more people will be aligned towards it. So nothing can work in silos. I hope I answered.
Changed as a big way. Even the attitude from the administrative side, be it the government, the approach towards the private sector has changed. So this attitude, we hope will continue, and the private sector and the government can work together for a better future. Thank you, panelists. Thank you so much.
Well, thank you so much for sharing your I would now like to invite on stage Mr. Vivekanand Mishra to present the mementos to our esteemed panelists. Mr. Rennie Varghese. Mr. N. Naveen Sona. Can we please have a huge round of applause? Dr. Hiren Ambegaonkar. And Dr. Swapnil Karnare. So much once again. I would also Well, ladies and gentlemen, now to give a technical presentation, I would like to invite on stage Ms. Ruchi Tushir, VP and GM Country Manager, Board Director, GGM India, Walters, Kluwer. Let's welcome her with a huge, huge round of applause, please.
I hope, I hope I'm audible to everyone here. Okay, great. So first and foremost, it's a great pleasure to be here to talk about a topic which is very close to my heart and our organization's heart as well, which is about, today I'm going to be of care, which includes healthcare, medical education, pharma companies, all of it put together. And I think before I get started, I just wanted to ask one simple question. What in the audience do we think is the most important aspect of digital health? Is it about more patient access? Is it about increased efficiency? Or is it about better quality? Or maybe for some hospital, less doctor burnout. To be honest, all of it is important. Every single thing is important, but at the core of digital health is the equitable health and the opportunity to have better patient outcomes. And this is an incredibly important mission. Now, we all know we were hit by the pandemic over the last few years. To healthcare, into pharmaceutical, into medical education. But at the same time, I think pandemic also taught us that digital health or digital initiatives are not easy to implement. Most of the times, it is very, very heavy on investment. Secondly, it's difficult to change the status quo. We're asking people to change how they've been operating to move to something new. It is very, very challenging to deploy in areas where you may not have technical interventions, for example, rural areas. And with always so much to do and so little budgets to have, it can be really difficult to know where to start. But I think the good news is that there are solutions. In a much more simpler manner. And I'm going to be talking about today, that throughout the presentation that I have to discuss here in this forum. We will see that they're very simplistic yet an objective. This conference and the discussion at this point in time is very opportune. We as a country have 7.35 doctors for every 10,000 people in the country. Now, as per WHO, this is definitely short. And WHO recommends that it should be, minimum 10 doctors for every 10,000 of people that we have in the country. Now, of course, we are very happy to see how more hospitals, medical schools, and hence qualified doctors who could actually help us improve this ratio a bit. The fact that there has been 10% increase in UG seats and 21% increase in PG seats over the last few years, it surely talks about how government is serious about this endeavor. Is it still producing the qualified ecosystem or the truly international level of capability that can help us address the gap of patient to doctor ratio? We do have a lot of doctors. I by no means say that the country is not doing enough, but at the end, it is about getting that right care for the right patient outcome. And how do we overcome these challenges? I'm just checking if this is working here. Yeah. The answer is very simple. medicine available to every doctor who's consulting a patient. And traditionally, how we have seen this happen is, if there is a scenario where the doctor may not know what to do or what to consult, looking at the condition, complexity of the condition, but is that really scalable? Is that really something with the complexity of lifestyle changes, disease, differential diseases? Is that the most optimal way to do? Probably not. And I do quote one of the books that I read some time back, which is Evidence-based medicine to evidence-based medicine. That truly sums up how we can create an equitable yet better patient outcome ecosystem with evidence-based medicine content available to physicians. In fact, there is actually strong data you can drive faster, accurate patient care. I'll actually be sharing that data throughout my slide deck here today. But if you read on the slide, Gautam Khanna, who's the CEO of PD Hinduja Hospital, he does outcomes as well as reducing physician burnout, which is equally important. To treat and what kind of physician or clinician burnout it must be causing. And we need to picture, why this is so critical. Think about all the steps that actually comes in the process to actually, of that treatment and, also imparting education to the patient. Now on the slide, you do see that there are some red spots there. Every red triangle is actually an opportunity for a decision and at the same time, a risk. Why I call it an opportunity and risk both is opportunity to take the right decision on the next steps to be followed for the step. It actually could be so critical, so catastrophic. It may even impact the mortality rate. That's extreme. And at the least, send both the doctor and the patient into a spin, which of course is causing a lot of time waste. All of it put together. So needless to say, every decision has to be supported by certain digital interventions which could make the life of a physician a lot more easier and a lot more effective, and at the same time, giving better patient outcome in the scenario that might be at play at particular point in time. Now, given the fact we're speaking a lot about CDSS, I did want to take a minute to explain what typically is a clinical decision support system. Content tool that is available or rather used at the point of care. For every doctor question that may be out there, it actually synthesizes proper ratings, etc., for an easy access to doctor when he needs it the most. Technology does come to foreplay in terms of providing a quick and easy access, but it is also about how deep and broad you could be with the content that allows the doctor to have all sorts. And there are a lot of learning tools which may be doing this synthesis, but it's also important that when the doctor or the physician is at the time of consulting a patient, he need not go through excerpts of books or for that matter journal articles to fetch out the right diagnosis which may help the patient of a CDSS tool comes in. It actually synthesizes in a format which is very, very relevant to the situation or scenario or diagnosis that the doctor is looking for. Best to start in medical education itself, because it's giving the students an opportunity to understand differential diagnosis, create their capability, and understand how to treat patients better. For residency or postgraduate students, and gaining confidence in landing the right diagnosis for a variety of crazy scenarios that are playing out these days in the health segment. Of all that humongous knowledge that sits out across the world at one point to be accessed when you're consulting with the patient. I did mention that CDSS helps answer doctors. But look at the stat here. Typically, in a clinician's or physician's day, there are 15 to 20 questions which actually go unanswered. Of those 15 to 20 questions, 60% at the end of day are still not answered. And there are almost 6 to 8 questions where they change the decision, or if you get the accuracy or the right input to support those unanswered questions, this truly impacts the actual could drive either in a hospital or in a clinic that he or she is consulting the patients. And doctors around the world do actually agree to the leverage of CDSS for a better outcome. If you look at this data set on the slide right now, and this is coming in from Up to Date, which is the CDS 30 years. As a matter of fact, it's Up to Date's birthday in 2023, 30th birthday. And we're very excited that it has been serving clinicians and physicians for last 29 years. And since I've been speaking, I think Up to Date has been accessed almost 8,000 times already, which just says the impact of this tool and the I also wanted to call out another study, which is a peer-reviewed published article at Tokyo Johto Hospital in Japan. And if you look at this, it clearly articulates wherever the diagnostic error rate 24 that we could provide the right diagnosis, how much it actually improves the patient outcome again, and the ROI for the hospital as well. So I think I made enough case for CDSS already. Having said that, there are already a lot of myths in the market when it comes to adopting CDSS. Some people think it's mandatory to have an EMR in place to actually people think it's very expensive technology infrastructure. Absolutely a myth. All you need is just a simple phone or a laptop or any other tool on which you can host a web page. That's about it. And how some people think even CDS may actually, it is a supporting tool which makes a doctor or a physician. I think it's all about having the high quality content, which is evidence-based, that comes to rescue, or rather that comes as a matter of fact, using a CDS can have an impact, immediate impact. And I wanted to talk about a scenario that we encountered when COVID years were on. So at that point in time, Wolters Kluwer decided to provide CDSS as a free tool for physicians across the world. 150,000 physicians who picked up that offer from us. And how it was able to help them deliver the best outcomes. As a matter of fact, there is a doctor in Nepal who actually mentioned how having an access to times of COVID when the information was not so rightly available, and most importantly, there was a lot of misinformation in the market, how to treat, what's going on. Backed, help them to create the right diagnosis and hence the right treatment plan for patients who were coming to take treatment there. Now, not every product that calls itself a CDSS can deliver these benefits. As a matter of fact, one has to be careful, when you're choosing a CDSS to ensure that you're looking for something which has should be able to leverage information quickly, easy to use. Like I mentioned earlier, a list of journals or excerpts of book is not kind of a form need to address with the patient at that point. Myths that I called out a couple of slides back, one has to put this all in together to see what is the right tool that will make sense for you as a hospital, as a pharmaceutical company who is supporting the medical education for physicians in a continued format, etc. So how do we also call out on the ROI? And I think this is one important element which is always asked by. And most importantly, I mean, it helps us reduce hospital stays, fewer procedures. I've already spoken about it, and I mean, there are enough and more studies that we have which can continue to corroborate the fact that all of this adds to the ROI of CDSS has changed patient care decisions 37% of the time, which actually improves both the quality and the efficiency of care. This is similar to the data that I had presented some time back when I said there are 5 to 8 decisions unanswered. Give the right diagnosis at the first go itself. You're actually saving a lot of time, fewer conversations, fewer visits to the hospital, and hence improve the efficiency and efficacies completely. And what's the ultimate goal of actually saving lives? And if there is a tool which can, give you better outcomes, and you can achieve a goal of saving life, I think that just goes above the ROI that I just called out. And the study that we've done here, the Harvard study, which was published by 11,500 lives in 3 years, and also a lot of reduced, visits to the hospital. Needless to say, nothing is more important than saving lives. So I think this is a great testimony to how CDS can truly impact the ecosystem of healthcare. But what's the most important element, of course, saving lives? It's equally important to have an understanding of whatever decision a hospital, a pharmaceutical company, a medical education institute takes. They have to keep in mind the impact it has on the patient and their families as you evaluate policy or investment decisions into technology. Let me quote an example here. This is again going back to Japan. This is a story of Dr. Satoshi and his 1-month-old baby as a patient that came to him. The baby was in a very, very bad scenario, constantly vomiting since the last day. And per the initial, diagnosis, Dr. Satoshi, who was a senior resident at that point in time, thought it is a case of diabetes, type 1 diabetes mellitus. Now, in infants, 1-month-old baby, these kind of he heard back that this is too rare and probably this is not the right diagnosis. He wasn't satisfied because all his tests, etc., were leading to this diagnosis only. He actually consulted Up to Date. It was actually concluded that the baby was having type 1 diabetes mellitus, and they went ahead with that course of treatment for the baby. And as you would anticipate, this had a happy ending. The baby was saved, and now Dr. Satoshi gets a postcard from the parents every year to say, showcase how he has been growing, etc. A nice story, but imagine if you could how we could make it a lot more effective and efficient all over again. Again, quoting Dr. Sanjeev Singh, who's the medical director at Amrita Institute of Medical Sciences, he equally resonates with the fact he talks about how it significantly improves patient safety, process efficiency, and the overall effectiveness of healthcare system. I also wanted to call out that while I've spoken about Japan examples, Nepal example, and Harvard studies, CDSS in India, especially UTD, is a big construct. If you look at the slide right now, we have more than 32,000 physicians in the country using Up to Date. 90%, not 90, I think 70% the fact that 200 hospitals already subscribe to this tool. Pharma companies, more than 20 plus pharma companies are already leveraging this tool to continue medical education for physicians on a regular basis. This just talks about the efficacy of this tool in the market that we operate in as well. And it is not just a tool of a global ecosystem, but something that Indian physicians have also placed huge faith on. And as a matter of fact, I think it's about having the equitable digital health. If we have evidence-based CDSS in every hospital, available to every clinician and in every medical and nursing college to help train clinicians of the future, I think we're going to march towards the digital health goal. And this is where I have some recommendations as well. For hospitals, I do strongly recommend that you do invest into a CDSS if not done already. And I recommend the same for pharma companies who invest in supporting clinical education. I'd rather even go a couple of steps forward, and I do know that this is a mixed audience of people representing hospitals, pharmaceutical companies, and even medical education policies, etc. The next set of recommendations is for people who contribute to policy development. I strongly feel that if we get medical education, medical schools start using CDSS as a teaching tool, it's truly gonna create physicians and clinicians of the future. The fact that this should be, it should be required for accreditation as well as in curriculum guidance as well. Libraries should be given budget to purchase it. Secondly, hospitals to quality care. And this can be done by, including CDSS in the accreditation requirements. At minimum, and we already have a lot of AIMS who are using Up to Date, but at minimum, we feel all the top colleges of the country should actually be using CDSS to draft guidelines from NMC, which are proposing a smaller number of hours for continuing medical education or CME credits, as we call it. I think that's great. However, if you could just, create or leverage CDSS as one of the tools to support the CME, it would just go a long way again in, leveraging digital tool for a better and delivering better ROI. And I think let's just not wait a day longer to implement this, leverage of CDSS into. That's what I had to cover today, and I'm happy to take any questions that may be out there. But just before that, I think I'd love to summarize what I just spoke about in a quick 2-minute video highlighting what a CDS says. It's not working? Okay. If there are any questions, we could address that in the meantime. There's somebody trying to speak there, sir. I can hear you.
Sorry if I missed that. How many clinicians are using up to date right now? Because I work with a pharmaceutical company from AstraZeneca, and we have spoken with a good number of thought leaders. But unsolicited, I think we haven't heard. Earlier in one of my earlier organizations, we used to talk about up to date, and even we had institutional access probably till last year. Now it is based on reactive basis. We do. Well, it is practiced.
So 32,000 clinicians in India already use up to date. Plus hospitals are already. We are much wider, but I mean, we'd be happy to connect with you to see how this meets your requirements, etc. I think Sir also had a question here. Yes. Thank you.
7.4 doctors per 10,000 people. So we are more dependent on the secondary layer, that is the nursing population, which is almost one and you having some initiatives for educating or updating them? For whenever you talk about healthcare emergencies, we are seeing that happening in COVID.
Actually, I just go ahead and say that they were first line of support in COVID year. I mean, they were actually portfolio of solutions that we have here. As a matter of fact, the utility that I showcased here is not just meant for doctors only. It is meant for nursing community as well. Patient education, which is the core for a nurse to be engaging with the patient. And truly, I mean, this is a product which is not just local, but a global product. And we all understand how . believe that if they start using CDSS and the other content that we have in educating nurses, they can definitely elevate the level that they're seen at in the country. We are, as a matter of fact, working with a lot of nursing community across hospitals, across colleges, which leverage a lot of Lippincott digital content, and I'm happy to connect with you after this session to talk about how that may support what's on your mind. Yeah.
Thank you.
All right. I think we can play the video now. Go ahead, please. Yeah.
Access to evidence-based clinical decision support improves healthcare outcomes. Studies show that it can change diagnostic and treatment decisions for nearly 1 in every 5 patients by answering clinicians' questions, 60% of which would otherwise go unanswered. Decisions every day, resulting in UpToDate is an electronic resource that provides the most current evidence-based clinical information at the point of care. It answers clinical questions in real time and increases clinical knowledge by synthesizing the latest and best available evidence into a U.S. healthcare information company found that hospitals using UpToDate had significantly shorter lengths of and they found that the more UpToDate was used, the greater the improvement in those outcomes. Researchers at Harvard University confirmed Solutions' findings. They established that the use of UpToDate in the 1,017 institutions studied days saved per year and 11,500 lives saved over 3 years. Use of UpToDate led to changes in patient care decisions over 35% of the time. They concluded that it was both feasible and useful in clinical decision-making, making it the most trusted resource of its kind. The bottom line? UpToDate, evidence-based clinical decision support improves patient care and reduces the need for date. Smarter decisions, better care.
Thank you, Paras, for running that one. Here, happy to engage in discussions with some.
Well, thank you so much, ma'am, for a wonderful presentation. And now, ladies and gentlemen, to give the last technical presentation, may I please invite on stage Dr. Karthik Ramesh, VP International Markets, Head Transformation and Innovations, EMIDS. Let's welcome him with a thunderous round of applause, please.
take some of those ideas, help them commercialize and monetize it. If you look at emits itself, as I said, we have consistently been rated by Everest Group, top of the quadrant when it comes to automation, when it comes to kind of payer technology services. And we are literally a leader when it comes to payer platforms. We are deep into providing provider implementations. While we do have our own platforms when it comes to data and analytics. So I'm just trying to move the slide. So am I supposed to point somewhere or? Okay, can you just move down because it's a PDF, maybe it's not working. Yeah, thank you. So we offer different delivery models to our clients, especially in the US. More than 90% of our business comes from, as I said, Fortune 100 companies in the US. So we are a very solution-driven, consulting-led approach company. When it comes to product engineering or software engineering, we work on a pod basis, which you see here. We work across the product management lifecycle, understanding the product requirements, designing it using the best of user and customer experience, driving the growth for our customers with our deep domain knowledge. So what differentiates us from other IT services company, large, medium or small, is our 24 years of deep domain knowledge when it comes to healthcare. And as I said, we have engineering centers both in India as well as nearshore locations in Mexico, Argentina, and Philippines. So we're kind of spread out across the world. And in terms of engagement models, we follow a very collaborative approach. We partner with our customers. If they want products, we help them engineer those products. We don't just sell our products. We are not into licensing or here's my product, take it, pay the license fee. We want our customers to evolve with their product roadmaps. Can you go to the next slide, please? Because it's not working. It's working. Now, we also have a very interesting platform which I want to talk to you about, which is called as the Digital Maturity Index. So we help a lot of companies, any of the organizations you are here from, we have expertise through a platform which assesses which part of the maturity curve you are when it comes to digitalization. But how do you pinpoint and say this is where you are? So we have a database of years of benchmarking. Based on that and a questionnaire-led approach, our consulting team in the US helps you. We have various parameters, statistical methods. We use some analytics-driven insights to develop this. Now, when it comes to data, everybody spoke about data since morning, analytics. We have deep capabilities when it comes to automation, AI, ML, and my friend Madan, my colleague, will talk about it shortly. But if you look at data, we have a platform which is called a Score Lake, which is a true data lake. In an era where there are plethora of data, business intelligence, analytics tools, our data lake helps to deal with all kinds of data formats through its ingestion engines. It has AI, ML capabilities, and it runs off cloud, AWS. Pretty much can be configured for any other I would say flagship platforms which our customers use. And in terms of the pyramid of how we approach data-led consulting, as I said, we work in a very consulting, advisory-driven approach. We do not just build, but we build to execute the design, and we leverage a lot of accelerators. So what differentiates us again from rest of the competition, and that's why the top-notch health companies in the world, especially in the US Fortune 100, work with us, is because of our methodologies, our established processes. We have also great expertise when it comes to interoperability, when it comes to the healthcare side of things. We also help streamline a lot of data operations, business rules engines, all of the good stuff when it comes to managing your data effectively. Partnerships again, be it AWS, Azure, Snowflake more recently, and also Google. My other hat which I wear is I also drive our cloud partnerships globally, work closely with these. With this, I'll invite my colleague Madan. I'll come back again to conclude. Madan is a very seasoned executive with more than 2.5 decades. Driving the entire delivery globally for our automation practice. Madan, over to you.
cover all these intelligent automation services crisp and clear within few minutes. Right. Everybody knows about automation, right? Automation is passionate about, they wanted to really go and automate in their organizations. So are we going to really creating automation like one more technical debt in the organization? Because that we should use that automation in intelligent way. So then only organizations or the enterprises will really get the real value from the automation. So if you look at any enterprise, automation revolves around different process. Any enterprise, if you look at, different business process will be there. If you are really going and trying to automate around only targeting one business unit, so it doesn't really serve the purpose of the automation. So that's where if we really look at in healthcare industry, 80% of the systems are still legacy systems. Applications which are coming into the enterprises. It can be in payer, provider, or life sciences industries. Technology is evolving like anything. It's very fast. It's evolving. Part of that, so many new applications are aligned to the business process which are there in the enterprises. If it is not aligned, then there is no use of automating specific process in siloed manner. Again, it will become, one more technical debt in the organization. So that's where first, if you need to look at our intelligent automation strategy. So as Karthik highlighted, we are specialized in, we have in-depth knowledge in the business, at the same time technology space as well. So that's where part of our intelligent automation strategy, we have strategic consultants where they'll go and identify the specific, what is the maturity level of the specific organization. We go and interview different business unit key stakeholders. We understand what is the level of maturity at organization level. So that's how we go and strategize. We really build the overall strategy for them. What are the strategies they have at organization level? Are those business objectives are really aligned with the new systems which are coming to the place? So that's where first we go and assess their maturity level. After that, we try to build the strategy. For that, really, they need to have proper governance in place. For that, center of excellence is one of the key pillar for any organization we need to build. So after building the COE, right, any automation engagement happens, first we need to land and expand mode. Any automation engagement runs. So that's where if we look at total, we have 100 plus process automation consultants. But also we have deployed 750 bots into production for various customers across payer, provider, and life sciences. We have delivered value like, if you look at range of conglomerates, for top 3 conglomerates, I can say CVS Health and Blue Cross Blue Shield. In different areas, we provided the process automation Fortune 500 customers. And also the kind of value we deliver to the customer, we improved the overall member registration, their operational efficiency. At the same time, we have delivered to customer. And also we have been recognized as a major contender in Everest Peak Matrix as a major contender in intelligent automation services. And also we process intelligence area, EAPath, Automation Anywhere, Microsoft Power Automate. Microsoft Azure, Google Cloud, and AWS. These are the various partnerships we have to provide the services around process reengineering, process intelligence, and process automation. These are the various things. Everything comes under intelligent process automation. So this is all overall about we deliver the value to our customers. We are happy to take any questions. If you want to really discuss with us, we are there to discuss with you. Thank you.
So to conclude, I'll just ask the video to be played. We'll just end on a high note of, making it a bit interactive. Did the video come? Can the audiovisual team just play the video website link? So as the video is coming up, if it is coming up, it was sent to Dushyant. Yeah. Is Dushyant there? Okay, so please try to figure that out. But the most interesting thing about eMIDS, as I said, is our academia industry collaboration. We have, if you can go down right there. We work with IIT Madras very closely, and we also have partnerships with other national, international universities. As I mentioned in my afternoon talk, we have run India's biggest healthcare hackathon ever, right, which partnered with 400 plus universities. The most prestigious achievement for us was to be selected by Krish Gopalakrishnan, former co-founder Infosys. He incubated a fund at IIT Madras Research Park for over $100 million. And we were lucky to be one of the top 11 finalists selected for one of our product ideas. We had the Gokwi founder in the afternoon, Vishal, talk about Gokwi. So we thought about something like this, a platform, even when the idea did not exist in the market. So we incubated this idea, and now we are trying to leverage this for our customers globally. And this is through a partnership-based program with IIT Madras Research Park, which has more than 300 plus startups. And that's where our global innovation labs is. So just the next 2 minutes video, we're going to show you how we are offering innovation, how we are offering disruptive thinking as a service to our customers. So unlike other software companies, we partner with our customers. They look at us as their extended innovation labs. And what you're going to see is a sample of what my team has done. So you can play the video. Thank you.
I'm Saurabh Sinha. I'm the founder and CEO of eMIDS Technologies. We provide digital tech services to healthcare and life sciences industry.
Hi everyone, Team eMIDS here. This is a Bangalore office space, and we run a full-fledged innovation labs starting from robots, rovers powered by NVIDIA, virtual reality platforms, this is a workspace at the initiatives with startups, incubators, and accelerators across the ecosystem.
The greatest of journeys begin with that one single step, and the firm forward footstep was taken by our leadership team led by Balaji Sethuraman, Chief Operating Officer eMIDS, Sriraman Nagarajan, President of Life Sciences and Provider Business Unit. Both as former cognizant executives had the vision that we should translate our innovation internally of variables as connection as service and pitch it into GDC cohort. We thank our CEO and the leadership team for their constant encouragement.
With growing number of clinical devices, smart wearables, sensors, and monitors, there is a visible need to connect all these data streams from the user's devices to the caregiver's dashboard.
A big shout out to our faculty lead and business mentors who made the entire GDC journey seem like that of a flight at cruising altitude. And we as business class passengers, enamored by the flight, fancifully forgot the destination until we were asked to peek into the reality of the cockpit of what medical wearables and devices is all about. Our pilots, who really were our mentors, course corrected to the right target customer segment, who were none other than the pharma sponsors. Testing and validating the various subjects with the latest and greatest innovations in pharmaceutical space using our suggested framework. Thanks again to GDC.
So that was our collaboration with Gopal Krishnan Deshpande, Center for Entrepreneurship and Innovation at EMITS. We continue to do this, as I said, globally, and we're open to any conversations, questions on how we can help you disrupt your innovation journey. Thank you for the opportunity again to IHW, and thank you for your patience as we stood between you, the refreshments and the awards, and advance congratulations to all. Thank you.
Well, thank you so much, sir, for a wonderful presentation. With this, ladies and gentlemen, we have come to the end of our day session. We will resume our award ceremony at about 7 p.m. Request you to please join us here. I would like to thank all our speakers for being so dynamic, and thank you all for your patience and support. Refreshments are served. Please enjoy your meal and have a wonderful day ahead. Thank you.